In this video we're going to talk about endometriosis, very common condition, OBGYN condition. Well, what is endometriosis? By definition, it's basically a non-cancerous disorder in which the tissue that normally exists in the endometrium, which is the lining of the uterus, this tissue is found in ectopic places. Well, there's a lot of places that it can be found, but we're going to talk mostly about the structure that is limited to the area of the pelvic region. So when this endometrial tissue is found in ectopic places, first just list a few places. It can be found in the ovaries. It can be found in the ligaments of that pelvic area. It can be found in the posterior cul-de-sac. There's a long list of places, and I think it's good to get a visual picture of what exactly is happening before we get into this whole talk. So let's show you a little picture here. So we all know what this is. This is a nice diagram of the female reproductive organs, and the area I want you to look at here is this area right here. This area right here is the endometrium, and it's the inside of the uterus, and there's tissue here. And when it's currently, this green area is the normal location. Now look at this right here, endometriosis. What's happened is this tissue that I've colored in green has found its way into ectopic areas where it's not supposed to be. In this diagram, they've really just shown a few areas. They've shown the ovary, and they've shown the outside of the fallopian tubes right here. Actually, that one's on the outside. This one looks like it's on the inside. So this diagram illustrates what exactly is happening. Now, keep in mind that endometriosis, these implants or these ectopic tissues that are, I'm circling, they can be found in a lot of places. And there's a nice ligament there. This is a ligament. It's not just these places, but that's the fundamental aspect of endometriosis, that this endometrial tissue has somehow found its way in ectopic areas, and that causes problems. So let's go back and continue. So how does this happen? What is the etiology? Well, there's two theories. Okay, the first theory of why this is happening is a theory that involves retrograde menstruation. And what that means is during menstrual flow, the lining of the, go back to our diagram here, so normal menstrual flow, as you all know, it goes this way, but retrograde menstruation would be, the opposite way. And once the blood flows in the opposite way, it can carry with it some of this endometrial tissue, and that can end up in these ectopic places. So retrograde menstruation, that's one theory, one accepted hypothesis, not just theory. The other accepted hypothesis is something called metaplasia, and most of you remember metaplasia just talking about when a cell goes from one type to another. So in our example, we're talking about a type of epithelium called coelomic epithelium. Under a process of metaplasia, will transform to endometrium like glands in that location. So that's two accepted hypotheses of why this happens. Now let's talk about, before I get into the symptoms, I just want to mention, going back to that diagram, that these ectopic pieces of endometrial tissue have something called estrogen and progesterone receptors. And that's important because those receptors can grow what can allow these pieces of tissue to grow when there's changes in hormone levels, and that can present a huge problem, and we'll talk about how that can be managed. Alright, estrogen and progesterone receptors exist on those ectopic pieces of endometrial tissue. Now let's get into the symptoms. So what are the symptoms of endometriosis? Well, you have pelvic pain. You can have infertility. It's a big one, actually. Infertility is a huge problem. We have dysmenorrhea. This is pain during menstrual flow. And dyspareunia. This is pain during sexual intercourse. These together, if they happen together, pretty diagnostic symptoms of endometriosis. But the diagnosis is really done by something called laparoscopy. You really have to do this laparoscopy to visualize the ectopic tissue. And then once you visualize it, you can take a sample and send it for a biopsy. What do they look like? Well, there's this term. It's called powder burn lesions. Powder burn lesions. You'll see this on the licensing exams a lot. And what they're really describing are these purplish, brown spots that I guess resemble powder burns, and that's what you will see during the laparoscopy. And then when you do the biopsy, the lab will basically be able to tell you that this tissue is in fact endometrial tissue. And then finally, let's get into the treatment. Well, the treatment of endometriosis, there's certain stages, I guess, in terms of severity of treatment. The first is, you just manage it with NSAIDs, like naproxen or Aleve or ibuprofen, just for mild discomfort. But really, what the main treatment of the actual endometriosis medically is something called a GnRH agonist. Okay, and if you remember from your pharmacology days, the medication that we were talking about is Leuprolide. In North America, there's a brand name called Lupron. And what does this drug do? It actually suppresses estrogen production. And if you remember earlier, I talked that estrogen and progesterone actually make these pieces of endometrial tissue grow in the ectopic areas, and that can make the problem worse. Well, this actually suppresses the estrogen, so it prevents the ectopic tissue from growing. Now, the next part of the treatment really is you need to excise or remove those lesions. Excise or remove those lesions. And this can be done in a variety of ways. It can be done with a laser, or you can just excise them. And this third option here is done if you want to preserve fertility. Meaning the woman still wants to have children. But if the woman is done, she's completed her childbearing, then what's the option? Well, I'm sure you can figure it out. Hysterectomy. Just take it all out, because she's done with having children and she doesn't need to have those pelvic organs anymore. So this is a quick summary of endometriosis.